About penile curvatures. The penis was supposedly made to be straight, and there's good anatomical reasons for that. If it was curved, then it wouldn't be able to get where it's supposed to get. And having a curved penis can be certainly distressing. And I've seen people come to the office with penile curvatures of various different forms and various different shapes. So just know that they're out there, and they're a lot more common than you think. And certainly you would never find out by walking around the locker room unless everyone had an erection there, because a penile curvature, you would only see it once the erection is up. So certainly people don't discuss these at cocktail parties. Now that there's more and more data around that, it turns out that penile curvatures are a lot more common than we thought, partly because of the treatments are there. So when treatments are there, people start coming out with, hey, I have that, maybe I can get it treated. There's two important types of penile curvatures. The first one is called, it's a congenital curvature, and the second one is called Peyronie's disease. The first one is, it's been there since you were born. As soon as you had your first erection, you noticed that your penis was a little bit on the side. That's actually not a problem. Unless it's causing you pain on intercourse, unless it's preventing you from intercourse, then you really don't need to worry about it. And usually that penile curvature is really, the curvature itself starts right at the base of the penis. Now the penis, I don't know if you know this or not, but the penis actually, half of it is coming out of your body, the other half is on the inside. So you can always say that your penis is actually double the size it really is without lying. If you notice at the base of the penis is coming to the side, and the penis itself is straight as soon as it comes out, then that's normal. It's a congenital curvature. However, if around the age of 30 or 40 or 50 or at some point in the middle of your life, you started noticing a curvature in the penis, a new curvature, and certainly one that causes you pain, and one that gives you pain while you're having intercourse, then that's a different story. Then that's called Peyronie's disease. And typically that's a scar that's formed somewhere along the shaft of the penis. And the scar, because the scar, when you cut yourself on your skin, you see that the scar forms, and that it sort of tightens the skin together. And it's meant to do that because when it pulls the skin together, where the scar used to be is even stronger. It's sort of like a defense mechanism that the body has come up with. So when the scar pulls the skin together, well, it's pulling it on one side but not on the other. So the scar on the penis from Peyronie's disease is not on the skin, it's on the inside, on the corpora. Now the corpora is a really tough, dense tissue that's supposed to hold the blood together to make the penis hard when there's very high pressure inside the penis. Well, if there's a scar on that tissue on one side but not on the other, well, it's going to be pulling the tissue together on one side but not the other, and that itself is going to create the curvature. So what can be done? Well, there are solutions. There's all sorts of treatments. The three major ones that I'll just mention right now, and we can talk about them more in detail on the other pages, is the first one is penile traction devices, and these are devices that are meant to stretch out your penis, just like you stretch out a tendon or stretch out your hand. The more you stretch it, the more you help break that scar or stretch the scar. The second one's called it's a collagenase. It's an enzyme that eats away at the scar, and with molding or with stretching, as well as the injection of this collagenase, and the company that makes it calls it Xiaflex, and there's a dedicated page that you can visit about Xiaflex. So Xiaflex is effective treatment. If Xiaflex doesn't work, we can even do surgery. We can excise the scar and replace it with a graft, or we can also recreate a bunching up of tissue on the other side. So if you can imagine that the tissue is all bunched up here, and we bunch it up here, then that sort of straighten out the penis. So each one of those treatments has benefits and has risks and has inconveniences and has pluses and minuses. Depending on where the curvature is and depending on what it looks like, then you might benefit more or less from different treatments.